sir. Good morning. Welcome to Viewpoint, your program of politicians, perspectives, and personalities. We have all three this morning. By the way, the first thing the old man wants to do this morning is we always try to start Viewpoint with a kudo or two. One will do. Right here in the city of Atlanta, Illinois, one of your own businesses, right out there, the Country Air Restaurant on the east side of Atlanta. Today, they're donating some of their proceeds, a percentage of their proceeds, to the Illinois Veterans Association, and more specifically the Tiny Homes for Veterans. I got it right. Testing. Shall we start all over again? Anyway, making a point to even drive up from Lincoln to the Country Air. By the way, they put up pretty good on food anyway. So just for that reason alone is worth the trip. But that would help the veterans, Tiny Homes for Veterans, at such a big thing here. And while we're talking about that, I just want to throw a kudo to Haji Patel, who has donated some real estate for those veterans' tiny homes. So the man puts his money back into his community, and so doff my hat to him. Our guest this morning, oh, by the way, my sidekick, Gossett Kirby, he needs to visit the 3rd Street Health Fair. He's under the weather this morning, so the old man's going to go solo. Our guest this morning is a gentleman we've had before on Viewpoint. Back in the old fellow's time, our county nurse department was run by one lady, Irma Potter. Lived out on the east side of town there on the road to Mount Pulaski, and she was the county nurse. And God love her, she was dedicated. She truly was dedicated, and I worked with her when I was with the Elks Lodge as chairman of the Crippled Children Committee. And I remember Mrs. Potter would call me and say, Johnny needs, or Florence needs something. And I'd say to Mrs. Potter, if you think so, just go right ahead and get it. It's okay. You don't have to call for permission. You just do it. But every time she'd do that. But she was a dedicated lady. And she was the forerunner of what we have on 3rd Street. Mr. Don Cavi is managing the ship that flies on 3rd Street there, the Logan County Health Department. So let's take it from the top, Don. How did you come aboard out here? And tell us, let's go back to the inception of our Logan County Health Department to let us create that place on 3rd Street.
Yeah. Well, I've been with the health department since 2009. My understanding is the Logan County Health Department, though it had a couple different locations. It's been through a lot of different locations. I think the other one was out by 5th Street or out by the hospital there, if I remember. And it's since in the 90s, we took over I guess it's the old warehouse, the old... people tell me I wasn't there at the time. It used to be a casket factory.
That was Darling's Casket. They made caskets there way back when I was a kid.
Right.
And before.
And that was so it was the early 90s that the health department moved in there. I've been there, like I said, since 2009. My career in public health started in Peoria, and then I also worked in Woodford County. But my background was primarily environmental health. Uh-huh. So, and I know years ago I was on your show and we talked about food inspections and radon and all sorts of things. So that's how I came into being at the health department. I took a job here in 2009. The environmental job opened up, and the administrator at the time, Mark Hilliard, was kind enough to hire me.
Him now.
Oh yeah, and I still keep in touch with him. He's a good man, and so I was the environmental director until Mark retired in 2014, and then that's when I stepped in, and he paved the way for some really good things. He brought in the dental clinic, so kudos to Mark on that, which is now kind of evolved to the point where it's part of a federally qualified health center through SIU now.
And that's still an active part of your department.
Oh yeah.
Very interesting.
It's just not under my management
pretty
wing.
Good patient load in that, sir?
Oh man, I remember when they were part of the health department, they had somewhere around 5,000 patients, 5,000 or 6,000. They have quite a few, 5,000 or 6,000 patients there now. And thankfully, my goal when SIU came in to bring their satellite facility in, we got the grant through the foundation at Abraham Lincoln Memorial Hospital. That's what it was called at the time, at least, to build a medical clinic, which kind of paved the way for SIU to bring their FQHC in. So they've got their medical clinic working there, but part of the deal was they wanted to also have a medical or dental clinic there too. So they took over ours, which actually worked out much better because when the dental clinic was part of public health, our mission was to serve the underserved. And so we billed Medicaid for a lot of our services. Unfortunately, at the time, the state's reimbursement rates were very low for Medicaid. For instance, if we did a cleaning, we got anywhere from $25 to $50 to do that. And, you've got a hygienist, you've got a dentist, you've got a couple dental assistants to try to support, and it just wasn't feasible for us. So now it works out real good where SIU being an FQHC gets a much higher reimbursement rate. They can afford to stay there, and they basically pay rent to use our building. But the great thing about this whole operation is it's seamless. We still have dental services, and they're still providing services to all of the community, including the underserved, which is great.
So we have some of our community members who probably, am I safe in saying this, would not be seeing a dentist if it weren't for your clinic that you have on 3rd Street there?
Very likely. Very likely.
That's a pretty serious thing.
Yeah.
Don, how many people do you have out there at 3rd Street Clinic now?
We have, health department employees, we have about 21. And then with SIU, they
That's
have
Southern Illinois
12 or
University
15.
that Don's talking about.
Southern
so
Illinois, yes. The Centers for what is it called? Oh gosh, I'm drawing a blank on that. Just all we know is that they have their federally qualified health center. They have primary care services and dental services. They operate out of our building. So
it's okay to draw a blank. I've drawn blanks up here for a number of years. It's really all right.
Yeah.
I wanted to mention. I guess we couldn't talk about a health clinic in any county without mentioning the dreaded word COVID. So where do we stand here on Wednesday, the 13th, 15th, whatever, 15th, with COVID in Logan County?
Yeah, we're keeping a close eye on it right now. The state looks at the rates of positive tests, and they look at all different matrix and measurements and determine whether the counties in Illinois are at a transmission level, which would be either elevated or low or high. And right now, as of last week, there were only a few handful of counties that were elevated. The rest of them were low risk for transmissions, which is a good sign. But we're still very cautious about this because not as many people are testing these days. And we did have a spike in cases here in Logan County. Sadly, we had, I know there was a handful of people who passed away in their 60s or older. And then we also had somebody, a child under a year that passed away. So sadly so we're still being very cautious about COVID. It's out there still, and we're still reminding people that, especially people who are considered high risk, to be careful when you go out. If you're in crowds, wear your masks to avoid crowds, and the same things, socially distance and hand washing is certainly always important too.
Well, all these directives and suggestions and/or orders whence cometh they? From Washington? Where do you get your directions from? They filter down from Washington to the state of Illinois and then to places like the Logan County Health Department? How does that work?
Yeah, the CDC sets the standards for everything. And then the Illinois Department of Public Health. We're a certified health department, so a lot of our funding comes through the Illinois Department of Public Health. We have to operate a food sanitation, a potable water well program, and a proper sewage disposal sanitation program, and a communicable disease program to be a certified health department. So we are a certified health department, and we do operate through the state. So we have to pretty much follow the directives. If the CDC says, this is what we're recommending, then we listen to what the state says. So they'll take the CDC recommendations and then lay the guidance down for the local health departments, and we follow through accordingly. So
before we go to a commercial, I want to remind you of the number to call. Some of you may have somebody in your own home that has a COVID problem, or perhaps just across the line is maybe suggesting that they might have that problem. 648-5510 is your number to call. And right now we'll take a break to acknowledge our sponsors. Thank you, James. Right back live in the studios here, WLCN. Viewpoint is your program this morning, each Wednesday morning at 8:15 to 0900 hours. Our guest this morning, Mr. Don Cavi. He's captain of the ship called the Good Ship Health that sails on 3rd Street. We have a very lucky situation here in Logan County to have available to us our Logan County Health Department. They do a tremendous job, and I think you and I, most of us out there, would be staggered to know the number of people they see over a period of a week's time. Do a lot of good. Let's talk about COVID shots, Mr. Covey. As we were saying off air, those of us who lived at the Christian Village were taken care of. We went in and had our shots on schedule whenever they were scheduled, and we got our booster. And I say, I'm assuming I'm in good shape as far as shots and boosters are concerned. Give us a little rundown on getting COVID shots, and if somebody has not had a shot at this point in time, I suspect they should be fair game to get one right away.
Yeah, especially those who are immunocompromised. And I say especially because, the vaccine is, anybody can get the vaccine. But the bivalent vaccine was the one that is the most recent one that came out. It was last year, and it provides better coverage for some of the variants that are developing with the COVID virus. And so we, if anybody out there is not sure if they're up to date on their vaccines, call your medical provider or even the health department, and we can find out through the state medical records through iCare to see where you're at with your vaccine. So we're always happy to help there. But we do encourage people who have not updated their boosters to go in and get a booster shot. We offer the vaccine at the health department on Tuesdays and Thursdays. Tuesdays Pfizer vaccine, and then Thursday we have the Moderna vaccine. So we do offer it for 2 days.
Those two separate pharmaceutical houses that have made the vaccine. How does one choose whether he gets the one from Pfizer or one from Moderna?
Yeah, there's really they're both effective. No, so it's really whatever somebody prefers. What I found, though, is most people that if their first vaccine was Moderna, they tend to want to get their booster with Moderna. Although you can, there's no right or wrong, however you do it. But just people have a tendency to do that. Likewise with Pfizer, if they get their first Pfizer shot, then they like to get their Pfizer boosters. But heads or tails, really, they're both effective. Now the other thing is, and people often think, well, if I get the vaccine, I'm never going to get sick on it, which that's not the case. It's like the flu vaccine. You can still get the flu, but the issue is if you are vaccinated, you do have better coverage, so the likelihood of becoming severely ill is going to be much less. And we did, with COVID, I remember we were keeping track a couple years ago of all the people that were hospitalized, and about 70% of the people that were going into the hospital, I checked and found that they weren't vaccinated, which tells me that the vaccine seems to be helping people stay out of the hospital. So there is some truth to the fact that it does help people, not become severely ill if they have vaccine coverage. Well, it's not going to prevent it, though.
We've become used to getting a flu shot when the time comes in the year, and I've done that since that program started, and I've never had a problem. I presume that there are a lot of people out there in the listening area who maybe haven't had their shot yet. Would you advise them to see about getting a flu shot, sir?
Sure. I would always advise that. And the flu season, we're kind of getting towards the end of it, but we still have the vaccine available, and it never hurts to have it. We do carry right now. We don't have the high dose. We have the regular dose. But if anybody wants, they can call the health department, and we can provide that for them.
Well, I know Gene and I always made a trip out there, and it was just seamless to go in there, and in a few minutes you're out of there and you've had your flu shot. And I said, what a service to the community.
Yeah, that's a great advantage that Logan County has, is that we offer a wide variety of vaccines, from the shingles to the chicken pox to the, all your basic, your newborn shots. But the thing we're finding is that people from other counties like to come here because at their counties they have to make appointments and they may have to wait about a month or two before they can get in and get their shots. Where they come down. We've had people come down from the Chicago area come down for some of our services because they know they can get right in and they can get what they need. So that's really a benefit to the community that we, you don't have to make appointments, you just come right in, and it's quick, it's easy.
Now, you mentioned shingles. That's a shot that not everybody gives a lot of thought to, but you have a comment about single shots down.
Yeah, we do. We offer it at the health department, and it's one of those things, if you get it, it's nasty. And anybody who has had chicken pox is certainly at risk for developing shingles. But they also say that if somebody can't remember if they had the chicken pox or not, it's still advisable to get the shingle shot. You can still get the shingle shot for that. It's recommended for people 50 or older. However, if somebody is 19 or older, but they are immunocompromised in some way, it's still recommended they talk to their doctor about getting the shingles vaccine. So it's a 2-shot series vaccine, so you get one and then you have to wait anywhere from 2 to 6 months, somewhere in the ballpark of there, to get your second shot. So, but shingles, the vaccine is covered by Medicare Part D. And in addition to that, the Tdap vaccine also is covered under Medicare Part D, and that's the tetanus, diphtheria, whooping cough, the pertussis vaccine.
I'm sitting here thinking, we're talking about communicable diseases. Back when I was a kid, which was a long time back, but when a person, a youngster usually, picked up chicken pox or some other the health officer in the community would come out and they put a red sign on your door, and that was how it was handled. And Daddy had to stay out of work and not communicate with people.
Yeah,
and that was the basic way that they started handling communicable diseases. We've come a long way, baby.
Yeah. But you know what? You look back, and that's a start, because that's got the ball rolling, And if they never did it then public health might not be what it is today.
Well, we didn't have a Fauci in those days.
I better not comment on that one. Oh, boy.
Well, he's a lever that trips a lot of triggers. And there's supposed to be a congressional investigation about him. We'll see what happens about that. That's going to be an interesting thing. I think he's a charlatan myself, but that's my opinion. We get a lot of opinions that are different than mine out there.
And we'll just have to see what the investigation uncovers. And
648-5510. I have a gentleman who's given him his time and talent to come up here and talk to you about something that's very, very important to us in our community, our Logan County Health Department. We're extremely lucky to have that out there. And Don is right. That was the side of the old Lincoln Casket Company in those days. One of those caskets are still around somewhere, 6 feet deep or whatever.
Yeah.
But and by the way, that was one of the prominent industries back in our community. Today we have Cutler Hammer, Eaton Industries.
Yeah.
We had Lane and Fink. We had Pittsburgh Plate, and that's gone. Lane and Fink's gone. Really important parts of our economy. So we're lucky to sit here and have our own health department. Is getting help, getting employees a difficult thing? Professional employees is what I'm talking about. Is that a hard thing to get, to registered nurses and so forth that are qualified to do that?
Yeah, it is for local health departments, especially in rural areas. They're all having a hard time hiring and maintaining employees because the private sector tends to pay a lot better than the public sector.
The pay is so much better, yeah.
Yeah, and we, fortunately, we've been able to work with our staff and through our collective bargaining and negotiations, and we've been able to help them out as much as we possibly can. But I think that people enjoy working at the health department a lot, and they public health is one of those things that people do it not for the money, because they love the work they do. Mm-hmm. And that's the great thing about public health. We have gone to, in our clinic, we have hired LPNs and not RNs, and they do the job. They're wonderful. They do an excellent job. And, some health departments are going to that now, where they'll hire LPNs. There's a lot of RNs that want to work at the hospital settings. The difference there is, the hours in hospitals are not always the greatest. But, at the health department, it's pretty much, normal working hours, but the benefits are real good as well. So knock on wood, we've had very little turnover at the health department, and we have just a tremendous staff. We're kind of like a family over there.
Well, and that shows through when you walk through the doors and talk to somebody who's representing the health department. Those people are interested in you. They're not diffident about the way they handle you. They want to make sure that you get what you're there for. And so doing a great job in that department as far as just people to people is concerned. Earlier we talked about the business of COVID, and I noted them on your notes that you prepared, which I appreciate very much. Home COVID test. Let's just go into home COVID test for just a second, Mr. Cavi.
Yeah, we have those at the health department. If people would like them, they could just come in and we'll provide a test to them.
And what does that include, sir?
Basically, it's just something you do at home. It's a quick swab, and then you get a quick reading off of it, and it's real simple to use.
Painless, simple way to do it.
Painless, simple way of doing it. And but I will throw out there too that there are some pharmacies that are participating in this test to treat program, which if somebody who, for instance, is immunocompromised tests for COVID and they test positive, maybe they do a home test, they test positive, they can contact the pharmacy. If they are a participating pharmacy, the pharmacy, if they bring their test result in, then the pharmacy can connect them to a provider who can write a prescription, and then they can get an immediate prescription for one of those drugs that will, treat COVID before it has a chance to get to the point where they would have to be hospitalized. So there are a few therapeutics out there on the market that they would provide them with. So it's a test treat program. It's through the Department of Human Services. So if people want to go to the Department of Human Services website and look up test to treat, they can find out all sorts of information on that, and they can find out which pharmacies are participating in that.
To make an appointment is not necessary. If you walk in there and they'll take care of you. Essentially, is that correct?
At the pharmacies, I always recommend.
No, I mean at the Logan County Health Department.
Oh yeah, absolutely. No, and if somebody wants to come in and get their booster shot or their vaccine for COVID or any vaccine, they can stop right in, and no appointments necessary. I tell people, though, if you're traveling, if you have a little bit of traveling to do, it doesn't hurt to call our phone number, the 217-735-2317 number, and just call ahead of time to make sure we have the vaccine available. We usually do, but it never hurts, because you hate to see somebody make a trip out and then all of a sudden, don't have the vaccine.
What about where do you get your vaccines? From whence do you get your vaccines? Where do they come from? Directly from pharmaceutical labs?
We work with some of the pharmaceutical companies, and we get some pretty good deals on working with some of the pharmaceutical companies. So in essence, that's how we get our vaccine. Mm-hmm. Correct.
648-5510. 648-5510. Don Cavi not representing, he's the chief sailor out there on that ship, our Logan County Health Department. Those of you who might not know about that might have a question or two. It's a very, very important thing that we have in our community, and it's for us, the taxpayer.
Yeah.
You just do a tremendous service out there. You go from aardvark to zebra, really, as far as what you perform for the community and health services.
Well, thank you. Yeah, and like I said before, we're it's nice that we can not only provide our services, but, SIU and the same roof can perform, the primary care and the dental services. It's Centers for Family Medicine is what they call themselves, is the name of their medical clinic. So if anybody calls the health department, there's 2 extension lines. They either call, dial, I think it's 1. I might have this crossed up for the health department, or 2 for SIU, Center for Family Medicine. It might be the other way around, but either way, there's an option. So wait till you get prompted, and then you can get connected to either one.
Let's go back to the shingles business again, because I noticed you have an outline on the shingles department here. Let's talk about somebody, Joe or Sally Smith, walking down the street is susceptible to. We're all susceptible to the disease of shingles. Is that correct?
We are, as well, especially if you've had the chicken pox, is when you
that was
really
a trigger.
Yeah, but most people don't remember, and
No.
and like I said, it's if you don't remember, you can still get the shingle shot, and if you're not sure, it never hurts to get the shingle shot. And the nice thing about our clinic too is we do bill directly, private insurance and public insurance as well. So people don't have to worry about it. Just bring your insurance card in, and we'll take care of the billing for you.
It's seamless, so it's an easy thing to take care of your own body.
Oh yeah. And if people want more information, they go to our website at www.lcdph.org.
That's too much for them again.
Yeah. One more time. www.lcdph.org. That's an acronym for Logan County Department of Public Health.
Don't forget to put the dot in there.
Yeah, exactly.
Is there one problem health-wise that is prevalent in our county that it seems to be a problem for the citizens?
We every 3 years we work with the Lincoln Memorial Hospital, and they work with the community, with the Community Health Collaborative, and we do there's a local needs assessment that the county does, and again, it's every 3 years. And what has been identified as 3 of the top priorities in the community for the community as a whole to address is, number 1 is behavioral health. Our health department is focusing on behavioral health as a whole, whereas the part of the community plan, it's for children. And then the other things is obesity and drug abuse prevention. That's something that we need to focus on. So we are doing that. The behavioral health is a huge issue. I mean, look what happened at Michigan State University this week, and it just tells you there's all sorts of issues going on where people are really struggling, and mental health is becoming a real issue. COVID didn't help matters. The economy doesn't help. People. They're struggling, and I looked up some statistics, and in 2021, I believe this was the CDC, stated that about 21% of adults are getting treatment for mental health illness, whereas with children back even in 2016, the data showed that 17% of children were receiving some kind of mental health treatment. So it's very prevalent, and I put out a press release back in December, and I want to kind of get this out to people. In the press release, if they want to go to our website, and we archive all of our press releases, so they can look up the press release. It just came out in December of last year, and it talks about mental health illness and how to identify it. But there are also important resources in there that people can call. For instance, if somebody is feeling suicidal, if they're going through some kind of a crisis, a mental health crisis, there's a national number, 988. I'll say it again, 988. They can call to get immediate assistance. We're trying to get people to use the 988 number as opposed to the 911 number, because 911 is more for life-threatening situations. If somebody falls or gets into an accident and they need immediate medical care, we want those people to call 911 or the public health emergency of some sort. But if it's a mental health crisis, people should call the 988 number. But in that press release, there's also some other local numbers that people can call for Memorial Health Services. They have a whole behavioral health section, and they work with crisis individuals. And there are numbers in that press release, local numbers that people could call, and that's through Memorial Behavioral Health. So I wanted to make sure we get that out there as well. And then we also have a mental health advisory council that in the community that we've started about 5 or 6 years ago.
Made up of community members, sir?
Correct. And we have people from law enforcement, veterans, from the mental health community through Memorial and through local social service organizations that are all participating in this group. Plus we have, somebody at our county board, and we're an advisory group to the county board. And we've been able to do some really neat things last few months as we're able to get the county board to work with the Sojourn Office to update the Sojourn Office to make it more inviting for people when they have to go there, because they really didn't have a waiting area. So we're doing that. We're going to look into coming up with a data sharing system in the community. We're going to meet and discuss that a little bit further about how we can look at data and how we can use it to solve issues here in the community. In other words, if we can find data on people who are frequent users, people who frequent the detainment system, the people who are commonly in jail here, people who use the crisis who go to crisis services frequently. If we can identify these individuals to work with them more, to try to help them, but also maybe get to the root cause problem, what's driving people to have to use these services, or what drives people why they're ending up in jail frequently. And if we can get to the root cause issues here, and there seems to be a lot of interest in analyzing data locally and working with local partners to pool data and share data, so we can come up with some solutions to some of the problems. So we're gonna sit down and start working with that too. So we're hoping the Mental Health Advisory Council, we can provide a lot of direction to the county board on maybe some of the things that we really need to do. And the county board has been super receptive to this, so we're really appreciative of that. So, but bottom line is I want to get that number out there, 988. If somebody's going through crisis, that's a national number to call, especially if they're feeling suicidal or just having a bad mental health day and they need to,
Now, Mr. Cavi, we're talking generally about diseases. Would you say that mental health would rank in there with, it's not a communicable disease, but that's addiction. That's a disease, not by definition, but in reality, somebody who's addicted to something, that's very important to them. They have a disease of some sort.
Absolutely. And the two go hand in hand, really. I mean, there's...
mental health clinic is an important part of your services to the community. And what about obesity? Do we consider that generally under the heading of it's a weakness, perhaps? And I don't know if that's correct phraseology to use. I don't know whether that's correct or not. One would think, God, they ought to be able to stop eating. Well, some people can't do that. So that comes under the mental health situation. Am I correct in that?
It could play in. Yeah, absolutely. There's a huge link to people who have mental illness, who have various health disorders, people who are commonly abusing drugs and alcohol. There's a link that, a lot of times they use that as an escape mechanism because they have a mental health issue. So they all kind of tie in hand. And, we are working... I know Chestnut Health Systems is working with the community to empower them. They've got this ROSC program right now, which is called, it's a recovery-oriented system of care. That's what that stands for. But it's really a holistic approach to helping people recover, find treatment, and recover from drug abuse and drug addictions so they can get their life back in order. And they are working with local partners through Logan and Mason County. And really, it's not their program. They're empowering the community to develop this program so, we can stand on our own 2 feet and have a a support system for people that are going through drug addictions and other crises related to drug and alcohol.
Drug addiction in Logan County, is that a problem, sir, as far as your walk-in patients are concerned?
Yeah, we don't. And, at the health department, we really don't. We don't offer mental health services at the health department, but I do know that through the Center for Family Medicine with SIU, they do have mental health services, and I know they work with Memorial. Mm-hmm. So I know there's a linkage there, so they can certainly call SIU, and SIU would link them to the proper health care, but they can certainly contact Memorial or that 988 number if they need help. There are resources in the community. We certainly wish there were more resources, but I know Memorial has been working hard to improve that. So,
the matter of drugs on the street, we might be surprised in Logan County to find out that there are a fair amount of drugs running around out there, and that our law establishment folks run into that all the time, I presume, when they're out on the street.
Yeah, it's getting a real problem, and the hospital too. They have their substance use prevention coalition too. So I know they're working hard to identify how we can improve the issue here at the health department. The one thing we do have is we can provide resources to people if they want to know if they have a drug addiction, where they can go for help. And, we are a huge resource center, but we also do provide naloxone, or what people call Narcan. So if people want to come pick some up, they can come to the health department, and we'll provide them at no cost Narcan, which, as you know, has been saving a lot of lives.
Yes, yeah. I presume it's in most squad cars now. I presume that when that situation would develop.
Absolutely, and I know early on we were training a lot of the police here in the community in terms of how to use Narcan. So we helped them get the ball rolling on that at the health department. So something I'm really happy and pleased that we were able to do to assist the law enforcement with. So that's,
So listeners, be very grateful in the fact that we do have this Logan County Health Department out there on 3rd Street. Well run, well organized. The folks are there to help you, and you'll never feel like you're stepping on anybody's toes when you walk through that front door.
Absolutely.
They're there to greet you and take care of your needs.
Yeah. Bill, if I could go back to, you brought up obesity, and I wanted to go on real quick. I just wanted to let people know, and I've talked to the Park District here, and they have programs to the community for where people can get exercise and they can lose weight. There's a lot of really good programs going on there. Mm-hmm. And we've certainly looked into it, the health department, and we are going to, at some point this year, we'd like to kick off some kind of a social media weight loss assistance program. So I'm working with our WIC department on that. And then, through WIC, we do provide the nutritional advisement for people who qualify for that program. But I really want to get the message out to people. The important thing with obesity is that people just need to get active and get out and exercise. The weather's been beautiful lately. Get out and take walks. Make sure you eat right. Get plenty of fruits and vegetables with your diet. So people need to take that initiative, but certainly there are resources in the community, like through the Park District, and some things we want to achieve that people can plug into that can also assist them if they need to lose weight.
I noted here at the very bottom of your notes here, sir, you under the heading of general resources, and you had the words rent, mortgage, utility assistance, food and clothing, advisories on such under those headquarters, under those titles. That's interesting to know that our health department will be available to help people who have those particular problems.
Yeah, actually, we had our mental health advisory council meeting last week, and somebody in our group, some person from Memorial Health Systems, Behavioral Health Systems, brought up this 211 number. And it's a general resources hotline number. And I learned about it last week. I wasn't aware of it. Some people on my staff knew about it, but I thought that's kind of a great thing I should maybe bring up to the public. But it is a resource hotline. And so, like you said, if people have need assistance with rent or mortgage, utility assistance, food, clothing, pregnancy or parenting resources, furniture, appliances, social service helper information, they can call this 211 number. Again, I'll say it, it's 211-211-211. WLCN-211 is the number. They can call that number to get assistance, or at least get directed in the area where they can try to find assistance. They also have a website out there. If you go on a search and just type in 211 resource hotline, you can find that, and then you type in your zip code, and then it'll guide you to the different resources.
You know, Mr. Cavi, I'm just sitting here thinking most of us go about our daily business without any cognizance or a thought about people who have problems every day. And we're talking about the street level, getting right down to basics, street level help for people who have a real need. So our Logan County Health Department is just more than health. It's mental health as well as our physical health.
Yeah, and we're a resource, and that's why I appreciate it when you invite me on your show, because it gives me an opportunity to share resources with people. A lot of these programs, you know, they may not be ours, but as public health, one of our goals is to let the public know what's out there. You know, we're not we don't have all, you know, we have our programs. We have 10 core services that we provide, and you know, we go beyond immunizations and food inspections, but there are behavioral health specialists out there. There are people that can help with mortgage and rent and provide, you know, legal guidance or whatever. And what we like to do is provide those resources so we can help connect people to some of the other services, some of the other great services that are available in the community. So we're kind of in that core right there. I'd like
to suggest to our folks who go through the doors out there to Logan County Health Department, make it a point to thank the people as you leave. They're there. They're not only getting a job and getting a paycheck, but they seem to evidence sincere care for their patients as they come through that door. So, Mr. Cavi, I appreciate it. My gosh, we run out of time already. And the folks, this is a chance to talk to you. Tough luck, kids. Thank you very much, Don Cavi, for being with us. Thank you very much, sir.
Thanks, Bill.